Hi guys, welcome back to my channel. So I'm making this video, it's about MECP, Medical Industry Commissioning Program, because in the past days, like there were like some people will reach out to me and ask me about like how to apply for the program, and then how to be competitive also. And again, like, my response is that like the program is very individualized because everyone has a different background. I was a mechanic. I'm still a mechanic right now until I finish my RN and then get commission, right? So again, the big thing is like whenever you apply for the program, you find a mentor because again, there's a MECP checklist that you have to like comply with, and then in order for you to stand out from the other people, you have to like be competitive enough to like um be above average on most of it on the checklist. So again, find a mentor, and then get again if it's your first time or like second time, and then you meet the checklist, but you believe that you're not really competitive, just apply for it. Because again, for me, it took me 5 times to apply before I get selected. So it's not end of the world, right? So at least you, like, even if you're not competitive and you apply, you get the experience of applying for the program, and then if you don't get selected the next year, you have more confidence in actually like uh preparing your package for to be superior from the previous year. So for me, like, I'm on my second semester in Jacksonville University. I'm a junior student now, junior one. uh it's different from the first semester because the first semester I was really like anxious, and then I don't know what to expect about nursing one because there's a lot of checkups. So you have to like perform like specific procedures and be able to follow step by step. Because again, for me, like, it's a different story because when I was a mechanic, like, I have to again proper maintenance, right? You have to perform step by step. But if I break it, I'm not gonna be able to kill somebody. But if you're in nursing school and you perform a sterile procedure and you didn't do it properly, of course somebody's gonna get injured if not killed. So you have to be really careful in following the procedure and make sure you comply with it. For second semester, it's so different. It's more again content heavy because the expectation is like we have to know more about like medications and how those medications affect an individual, like what's the therapeutic level, what's the antidote in case somebody gets overdose. So it's cool to like be able to know that part because before, when I was not in nursing school, like, if you hear advertisement on the TV or on the radio, it's like, okay, so it's sometimes like it's too good to be true, and then you don't really know um, the mechanism of action of that drug. So now, like, I get an idea of how to like know the drug and then how it works. Like, so actually be able to like educate the patients that I'm going to be working on. Also, like this semester, it's really awesome because again we are doing medical surgical. So learning how to deal with a lot of patients with different complications. Also mental health nursing. So that would be challenging for me because again I haven't really dealt with like someone uh, like who has mental health issue. Because like like if you're new to healthcare, like dealing with even somebody who doesn't have a mental issue is already a challenge. Like more so like if somebody has like suicidal ideation or like psychotic uh things. So you have to be careful when dealing with them because again as a nurse, you have to be like therapeutic when it comes to communicating with those patients, and you're not gonna be like doing like things like shutting them down, and the proper procedures. Again, they teach you that in nursing school, and again if you mess up you own up to it, and then also ask assistance from your faculty member or your professor for that. Again, if you're in the MISA program or interested in the MISA program, again, I'm available. You can just send me a message. Also, comment on this video down below, and then I'll try my best to answer the question. Again, everybody's different. And then if I don't know the answer, again, I can probably like reach out to other people who actually who might feel like can help you out in your application. All right, take care. Thanks for watching the video.